Good day, everyone. My name is Asian Tu Chen. The topic of Tech Talk that I'm going to introduce you today is medical training simulation in military healthcare system. Disclosure. I have no relevant financial relationships to disclose relating to the content of this activity. The views expressed in this presentation are those of the author and do not necessarily reflect the official policy or position of the Department of the Defense nor U.S. government. The key points that will be discussed today include background, the state of the art of medical training simulation in military healthcare system, current research and development of medical training simulation in modeling and simulation, current application of medical training simulation and its importance, and the future direction of medical training simulation in military healthcare system. Background. In World War II, the mortality rate of combat casualty wound was up to 30%, but dropped to 24% in the Vietnam War. The rate remained the same in the 1990s to 1991 conflict in the Persian Gulf War. In 1997, the Tactical Combat Casualty Care Program was developed for the Special Operations Medical Community. This program established pre-hospital trauma care guidelines for the front lines and reinitiated tourniquets as a frontline technique for hemorrhage management. In 1999, the Army focused on providing better medical care downrange and increased training for combat medics, which lowered the mortality rate to 10%. Despite the improvement in training, there were no significant changes in the number of soldiers dying from preventable deaths, and the U.S. Army Medical Command released an operational needs statement noting a substantial gap in battle-focused skills for combat medics. The goal was to stop the preventable deaths and to decrease the overall 10% mortality rate that deployed soldiers were still facing at the front line. Examples of the leading causes of preventable deaths due to traumatic injuries include extremely hemorrhage, junctional hemorrhage, tension pneumothorax, and airway trauma/obstructions. State of the art of medical training simulation in military healthcare system. The United States Army established Medical Simulation Training Center program in November 2005 to build, sustain, and standardize the skills of enlisted Army combat medics. In 2022, there are 21 Medical Simulation Training Center facilities located in the continental United States and outside the continental United States to train the U.S. Army medics and all deploying soldiers. These facilities enable medics to help train every soldier to use their individual first aid kit and its components, both for self-aid and potentially save a fallen comrade's life. Facilities have grown to incorporate augmented reality, massage patients, test trainers, live tissue models, and perfused or non-perfused cadavers. The Navy has used simulation as a training aid in several contexts. For instance, the USNS Mercy and USNS Comfort perform regular advanced phase training to perform and test the capability of the ship and the crews. These drills utilize cut-through simulators and simulated patients to allow for the practice of movement of personnel and at-sea life-saving procedures. The Navy also employs the Expeditionary Resuscitative Surgical System to provide care on board amphibious or large ship platforms at sea. This system includes the Expeditionary Trauma Team, Expeditionary Surgical Team, and the En route Care Team. In 2002, 3 Centers for Sustainment of Trauma and Readiness Skills were established to train better Air Force personnel in critical care air transport teams in Baltimore, St. Louis, and Cincinnati. The United States Air Force developed the Air Force Medical Modeling and Simulation Training in 2008 to establish and coordinate simulation centers worldwide. The Defense Healthcare Agency created the Department of Defense Modeling and Simulation Office as a central coordinating office for healthcare simulations across all services in 2015. The goal is to get the Army, Navy, and Air Force simulation efforts to work more cohesively in developing and implementing simulation methods to train, gain, build, and sustain medical skills for deployment readiness and to refresh skills needed for subspecialty skills. Current research and development of medical training simulations in modeling and simulations. Two types of equipment used include patient surrogates and modeled/simulated tissues. Patient surrogates are substitute for real patients used for the training. Examples of patient surrogates include virtual standardized patients, virtual physiological patients, multimedia virtual patients, high-fidelity mannequins, and test trainers. We will dive deeper into each of them in the following slides. Virtual standardized patients. It is completely virtual and it focuses on conversational interactions. The diagram in this slide is an example of standardized patient created by University of Southern California. Virtual physiological patients. It focuses on trauma and treatment-related scenarios, not on patient behavior or conversations. Examples of VPPs include Human Urban Mobility Simulator and Combat Medics by the Virtual Heroes Division of Applied Research Associates. Multimedia Virtual Patients. It is a web-based multimedia interactive experience that carries trainees with patient assessment and care scenario. Examples of MVP include Virtual Heroes Medics, T3Sim, and Decision Sim. High-fidelity mannequins. They are life-size and lifelike physical models, sometimes with robotic platforms. Vascular, airway, and cardiovascular resuscitation procedures may be performed. Examples of high-fidelity mannequin include Kaiser, Noel, iStan, and Siemens 3G. Test trainers. They made up the bulk of the commercial off-the-shelf market. They focus on specific type of categories of clinical procedures. Examples include ultrasound training blocks or IV placement and female exam trainers. Modeled/simulated tissues. Modeled are the making of realistic molded models of injured or diseased tissues and applying them to simulated patients or mannequins. Simulated tissues are physical materials that mimics human tissue. Current applications of medical training simulations. Examples include safe triage simulated scenarios, Special Operations Command Purpose Emergency Access Response, Point of Injury and Trauma Simulation, Joint Evacuation and Transport Simulation System. Safe Triage Simulated Scenarios. They are pre-deployment training performed on military students in the United Arab Emirates. The objective of this study is to test the retention of knowledge immediately after delivery of the course at day 30 and day 60 in military professional with no previous safe triage knowledge and with an undifferentiated professional background. The conclusion is that the knowledge of retention decreases after 60 days. Therefore, there is a need for regular and periodic refresher courses and training, especially for topics that are not applied regularly. Spirit Points. It provides a capability for the special operation team to train collectively on medical critical tasks in a mission scenario that replicates in a theater-safe house/team house environment. JET system. Currently, medical training is conducted within each service independently. Additionally, a diverse repertoire of tools, devices, and approaches is used to provide deployable training to service members, ranging from devices to computerized simulations to formal didactic training through internet-based video or classroom instructions. This study aims to add to the current body of knowledge by identifying and adjusting gaps in joint in-route care training and constructing a top-level interoperable framework for a training system of systems. The future direction of medical simulation training in military healthcare system. Number 1, augmented reality/virtual reality. At the Uniformed Services University Sim Center, an immersive VR theater is being used to train teams of providers in multiple casualty simulation and aeromedical evacuation of patients. Head-mounted VR displays are being tested in Army field environment to see if this type of simulation method can help first responders recognize and treat life-threatening hemorrhage and airway emergencies. Number 2, joint medical simulation instruction methods. To the end, the military healthcare system has launched Joint Medical Simulation Instruction Method, a standardized simulation instructor/operator online course that will allow simulation instructors to become familiar with effective training methods in healthcare simulation. The goal is for those who employ simulation for the training will be certified through this route. Number 3, graduate level education in simulation. There is a need for more advanced education and research in simulation methodology as it applies to operational military medicine. The Uniformed Services University has partnered with the Naval Postgraduate School in Monterey, California, to offer a jointly sponsored certificate program in healthcare simulation. Number 4, specific skill projects for developing specific knowledge, skill, and attribute skill sets for each medical specialty. The KSA is essentially an annual test list and serves as a marker for how prepared a practitioner is for deployed medical operations. These are the references used in the PowerPoint, and we came to the end of the presentation. Thank you.